Good morning, everybody. Another good day of testing with over 104,000 people coming forward. Thank you so much. The higher the rate of testing, the more confidence we have that we're scooping up all the cases in the community. To 8 p.m. last night, New South Wales had 199 cases of community transmission. Unfortunately, 50 of those were infectious in the community, and that's the number we're really watching to try and get down as much as we can. Again, workplaces and households are the main places where the virus is transmitting. So we urge everybody, if you must leave the house, assume everybody you're coming into contact with has the virus. It is still concentrating within those 8 local government areas of concern. But please know that if you live in adjoining communities, and Dr. Chant will talk about this, if you live in suburbs adjoining those 8 local government areas, please be extra careful. Don't go into those 8 local government areas unless absolutely necessary. But if you have the option, we're asking everybody not to go anywhere near those 8 local government areas unless you absolutely have to. In particular, if you live in adjoining suburbs, you might live in an adjoining suburb and go shopping in those communities. Consider going elsewhere to make sure that the virus doesn't spread into other communities. In New South Wales at the moment, we have 3.9 million jabs of vaccinations that have been provided, and thank you to everybody taking up the vaccine. By the end of August, I'd like to see that number go to 6 million jabs. We know that 10 million jabs gives us 80% of the adult population vaccinated. By the end of August, I'd like to see New South Wales record 6 million jabs, because every time we go through a milestone, 6 million jabs is roughly half the population with at least 1 or 2 doses. That gives us additional options as to what life looks like on the 29th of August. But as the health experts tell us, it's really critical to have our communities in those 8 local government areas take up the opportunity for vaccination. Some of those suburbs have averaged the vaccination the rest of the state. Some of them have lower the rate than other areas. And we do have a focused campaign to make sure people in those communities in particular have the opportunity to get vaccinated, whether it's through their workplace, through a health hub, through their GP or through a pharmacist. And that work will intensify because it's not only important to get to 6 million jabs by the end of August, but also to use our vaccine program to reduce the spread, to reduce the incidence of people passing it on to their households or their work colleagues. And we know, as the health experts tell us, that even 1 dose of the vaccine reduces the likelihood of how transmissible you are, how contagious you are. So not only is the vaccine really important to keep you out of hospital, to protect your loved ones, but it also reduces the number of people you may infect. And that's really important to consider when you're in the middle of an outbreak. So obviously we have the tight lockdown provisions. We also have the vaccine as our 2 main weapons of getting to a place where we can live more freely. And certainly that's our aim. On August 29, we want to see or be able to ease restrictions, but that will depend on where the case numbers are at, but also, of course, what the vaccination rate is at. So we're looking forward to us getting more jabs. 6 million is the target I want to set by the end of August. We're at 3.9 million. I suspect we'll be at 4 million by the end of the week or in the next few days. And that is a target I'd like to set for New South Wales. And I'm really urging everybody to come forward, to listen to the health advice. If you have any concerns, go through your GP. But please know that the more of us that get vaccinated, the greater chance we have to live freely beyond August 29. And in particular, we will be focusing our efforts in those 8 local government areas to make sure people have the opportunity to get vaccinated. And whilst I alluded to incentives yesterday, we're very keen to explore what opportunities we can provide. In particular, we know that people value their freedom, their desire to go back to work, their desire to engage in community life. And those are the type of incentives that we'll be looking at over the next little while to provide our citizens with the opportunities to know that if they're vaccinated and their loved ones are vaccinated, there will be opportunities for greater freedom moving forward. I'll now ask Dr. Chant to give her health update, and then we'll take some questions. Thank you.
Thank you very much, Premier. So there were 199 locally acquired cases of COVID reported to New South Wales Health in the 24 hours, and there was also 3 overseas acquired cases. Again, that testing rate of 104,536 tests is very pleasing, a great community response. Whilst we've focused significantly on the affected LGAs, it's important that we don't have complacency. across other local government areas, particularly with adjacent areas. So I want to particularly call out the Strathfield, Burwood suburbs and LGAs, and also Camden and Inner West, and Penrith, and some of the Bayside suburbs, particularly Rockdale, Kogarah. And I think this highlights the fact that the disease is actually got the potential to creep. And so we also are asking that you don't go into those suburbs, even if they're within that permitted radius, to shop, go to a different shopping centre. At this point, we want to minimise any risk of further spread of the virus to other areas. But anywhere across New South Wales and Greater Sydney, it is important that you take that precaution. We've got 53 cases in ICU, and I think this underscores the severity of COVID, and our data indicates that we are seeing more hospitalisations associated with the Delta strain. We have 5 cases are in their 20s, 6 are in their 30s, 3 are in their 40s, 18 are in their 50s, 11 in their 60s, and 10 are in their 70s. And what's a key piece of information is that of the 53 people in ICU, 43 people are not vaccinated. So my big call out is to get vaccinated. Across all of the age groups, I look at the vaccine coverage data every night, which is on the Commonwealth website, and it really is quite tragic that we've got still people in their 90s that are unprotected, still people in their 80s and 70s and 60s, notwithstanding other age groups that are not protected. So again, 1 dose of either vaccine is very effective at reducing hospitalisation. 2 doses are best. And we have reduced the recommendation for the AstraZeneca interval to 4 weeks instead of the usual 12 weeks, just so that we can get that second dose into people at this time. And I would urge everyone to discuss with your immunisation provider the risks and benefits of vaccination for your particular circumstances. Make an informed decision and consider vaccination is my probably key message.
Premier, when will you release the roadmap out of lockdown, and why haven't you done so before now?
Well, I think it's very, very important for us to communicate definite information to the public around what life will look like on the 29th of August. And we don't know the answer to that yet, but is the government starting to think about that, planning ahead? Of course we are, based on the health advice. We're keen to ensure we provide as much freedom as possible whilst living safely. And when we're ready to do that, when the health advice gives us an indication of what life will look like on the 29th of August, of course we'll convey that. But the challenge for us is we don't know where the case numbers will be in a month's time. And it's a combination of case numbers plus the vaccination rate that will allow us to consider what restrictions we can ease at that time. And therefore, it's really important for us to manage expectations. I don't want to raise expectations because we have a lot of hard work to do between now and the 28th of August. We need to really see those case numbers come down, and I'm really keen to us to get to those 6 million jabs by the end of August as well. On the current rate that we're doing, we should be able to get there with the jabs, but it's also important, as our health experts tell us, to make sure we concentrate those vaccination rates in those 8 local government areas of concern, because that will slow down the spread, it will reduce the case numbers. So as Dr. Chan has said, the vaccine isn't just about keeping you out of hospital and keeping you safe, but it's reducing the spread of the virus, reducing the case numbers as well. And we've certainly upped the ante in terms of going out to local communities, going out to local businesses, engaging with different organisations and sections of the community to really increase those vaccination rates, and also to provide opportunities for us to consider what life looks like on the 29th of August.
What do you think about the suggestion of a $300 payment for people to get vaccinated, given the argument is it could cost less than what we're currently hemorrhaging being shut?
Look, we've been looking at incentives for some time in the New South Wales government. We're really focusing on what we believe people really want at this stage. They want peace of mind that they can move more freely, send their kids to school, work, So any incentives around those things we think are great motivators. So we're looking at all those options, and we know that if we encourage people to get vaccinated to provide them with additional freedoms, that is probably the best motivator of all. But obviously we're going through all the options and considering those, but we believe, based on experience overseas and elsewhere, that allowing people additional movement or additional activity if they've been vaccinated, we think is a great incentive. So we're looking at those opportunities, and that will be linked to our plan for what life looks like on the 29th of August.
Hoops for people to jump through when it comes to vaccination, though. There are reports of people spending hours filling out eligibility criteria. Is it too hard for some people, especially young people?
Yeah, I was concerned to read about reports about the booking system and how long it's taking, so we're definitely looking at that. If we can streamline those opportunities, we will. And certainly we want to make it as easy as possible. That's why, whether it's through our GPs or through our pharmacists, through business and also through our own health hubs, we're trying to increase the access points, but we also appreciate it's important to make booking as easy as possible. So if there's anything we can do to improve the system, we will. But remember, everybody has to go through the Health Direct system, which is a federal system. So we're trying to make sure that our systems mesh with that as much as possible, but also reduce the time and energy it takes for people to get the bookings.
You've got this firm target, the firm target of 6 million by the end of August. Why can't you provide the incentives now that if we get to 6, you'll have this?
Oh, look, it's important to note that the incentives and the vaccine rates will also be linked to the case numbers. So we want the opportunity to try. I mean, we don't know whether we're through the worst of it or not in terms of the case numbers, and that's the issue that we have. We don't know if we've peaked or if it's going to get worse. It does concern me that there are still 50 people infectious yesterday in the community, and that could mean that we get higher numbers. So until we know what the cases are doing by the end of the month, it's important for us to keep those options open, but we do know that we have greater options if we hit that 6 million target. So if we know that at least half our population has had at least 1 dose, and in parts of the community where we're worried about if people have had at least 2 doses, we know that we can then consider other options, depending on where the case numbers are. But it's important for the community to appreciate that it's not just the vaccination rate we're looking at, it's not just the case numbers we'll be looking at, it's a combination of the two. But of course, that number of 50 infectious in the community, the closer that is to 0, the greater the freedom we'll have. But the further away from 0 it is, the less freedom we'll have, and that stands to reason. So we just need everybody to work hard to get the case numbers down, but also to get our vaccination rates as high as possible.
What is the case number target for the end of August? If we know what the vaccine number target is for the end of August to get our freedoms, what's the case number?
Well, obviously our number remains the same. We want to get to as close to 0 as possible when it comes to. Well, that hasn't changed, but what life looks like.
So is it 0?
What life, I've said was close to 0 as possible for some time, but what life looks like on the 29th of August will be determined by what the cases are doing, what the case numbers are, and also by our vaccination rate. So obviously, the closer you get to 0, you can go to life before the outbreak. But if you don't get to that number by that time, the vaccination gives you some level of protection as to what we can do at that time.
Close to 0, as close to 0 as possible doesn't exist. That's not a target that you can hit, because what if as close to 0 as possible is 50, like we recorded today? So what is the number? And also, you're talking about raising expectations. We can't really consider easing restrictions in the 29th of August if we've got half the population vaccinated, but still dozens of people wandering about the community whilst infectious, can we? We can't consider.
Well, I think it's important to consider a number of things. Whenever we get the health advice, it's in a particular context. So if there are people infectious in the community, where are they infectious? Is it concentrated within a local government area? Is it concentrated within a particular setting? So, as we all know, as you all know, life during a pandemic isn't black and white, but we know what the health advice tells us. The fewer people infectious in the community gives us a better appreciation for what the virus is doing and the fact that we won't have another outbreak, and that gives us a level of confidence. And secondly, having high rates of vaccination does allow us to consider opportunities to have some level of activity increase, notwithstanding where we might be at in a month's time. So the combination of reduction in case numbers but also higher vaccination rates gives us more options as to how our community can live as safely and as freely as possible, and they're the options we're looking at.
The Burnett Institute modelling says that even with 70 to 80% vaccination rates, you will have thousands of deaths if you reduce
the restrictions. If we relax at 50%, what level of deaths or hospitalisations do you think is reasonable for New South Wales to tolerate?
Can I be very clear? We would never relax completely at 50% vaccination rates. The Doherty report, which I understand will be made public soon, and I look forward to that being made public soon, talks about the kind of freedoms you would expect at 80% and 70%. You're not going to get those same freedoms at 50%, especially when you have cases. So I want to be very clear about that. But every milestone we hit gives government more options. It gives us the ability to take the health advice and know that when a certain proportion of the population is vaccinated, it does present you with more options. And similar modelling told us that during the outbreak would be up to 500 cases today, and we're at 199. So modelling has its place, and there are different models out there. But in New South Wales, we'll continue to rely on our health experts who've served us well, and we'll continue to make sure we provide the public with as much information as we have.
Pharmacies in southwest Sydney are concerned about supply. They're going through their 300 doses very quickly. What's been done to ensure that they're getting the supply that they need, considering that we are hearing complaints that vaccination rates in those areas are not as high as you'd like them to be?
Yeah, I might ask Dr. Chan to answer that question.
The Deputy Secretary, Susan Pearce, who is responsible for vaccine rollout from the New South Wales perspective, has been working closely with the Commonwealth, who is providing the doses of the vaccine to the pharmacies. I was advised on the weekend that mechanisms have been put in place for the pharmacies to call a 24-hour hotline to get those resupplies, because obviously we want to make sure that vaccines get into arms, and we don't want people to have an experience where they've gone to get vaccinated and there is no supply. So I would urge any pharmacy that is having any difficulty with resupply to ring the hotline, ring their Commonwealth. They should have a number to ring that and stress the urgency of it, and please keep ringing and escalate because it's too critical. I do not want anyone turned away in southwestern Sydney, or anywhere for that matter, who wants to have a vaccination.
You know, you can't get a jab at a pharmacy. You have to GP shop to get, if you're under 40, you have to GP shop to get someone to give you the AZ. And the mass vax hubs, the appointments are filling up very fast. We keep hearing we're awash with AstraZeneca. What can be done to increase the number of jabs of AstraZeneca being done outside of southwest Sydney?
So the Commonwealth is also rolling out a number of pharmacies outside. So progressively there will be a large number of pharmacies brought online. Obviously, and with our great support, we supported the focus on southwestern Sydney, access first, but increasingly there will be GP access through pharmacies. Sorry, there will be access to AstraZeneca through pharmacies, and I would urge people to go and talk to their pharmacist who can take them through those risk benefits and what to look out for and get vaccinated.
Dr. Shant, some exposure sites are taking up to 2 weeks to end up on the venues of concern. Why is there such a lag, and is this perhaps maybe a reason why we're still seeing so many people still infectious in the community?
So there's a couple of reasons why the exposure sites can be delayed. In some cases, people have been unwell for a period of time. So people may have had symptoms for 7 or 8 days, and then we have to go back 2 days before that in terms of their exposure sites. We're also surging to make sure we're on time and getting up those venues, but we also text people. So again, the importance of the QR code, I don't know if anyone's received them, but that text does come to you, and it's a really efficient way where we can get direct messaging, because we are conscious that not everyone goes to the website every day, although I do urge you to check it. But that QR check-in system where we actually text people directly is very efficient at reaching people.
Dr. Chan, just on that, exposure sites, we're consistently seeing supermarkets included. Do we need more measures in place? Do we need security guards? Do we need police presence to make sure that people are following the rules in supermarkets?
So it's important to know that the supermarkets are there because people have gone there for them, and that's, you know, expected. People have to eat, and they've gone there. Now, that just because they're there, it doesn't mean that they've actually transmitted, that we haven't had transmission. We have had transmission in a small number of supermarkets, and that's generally been when one of the staff have brought it in from a community exposure, and then there's been workplace transmission. There's been a couple of cases where patrons have infected staff, but generally it's been that other way. So the key issue is we don't actually think the large supermarkets are a great risk, but for transparency, we put the information there. We do ask people to cooperate with the public health guidance, which will generally be for supermarkets, go and get a test. But it is important that we differentiate between those higher risk venues. So the venues that we're particularly concerned about are the smaller grocery stops, the smaller facility where you might have a large number of people congregating, and that promotes you to talk to your neighbour or your friend. So what we're really urging is for those small businesses is that they minimise the number in the shop, people wait outdoors, just again to avoid those points where you might have that interaction.
Freddie, just on the supermarkets, the police minister. Sorry, just on the supermarkets, sorry, Ursula. The police minister today has said he'd like to see security guards, not just staff, but security guards employed at supermarkets to enforce the QR code check-in. Will that happen?
Well, obviously police do those compliance checks, but as Dr Chant and the health advice say, we want as little human contact as possible. So the QR codes are there for people to use them, but even having a concierge person there is a risk, as Dr Chant has said previously. So you need to be careful to minimise human-to-human contact. So the police are obviously targeting key areas where people are needing to leave the house to make sure there is high level of compliance. But please know the strongest message is, unfortunately, as cruel as this sounds, we just want as little human contact with each other as possible. So make sure, as the health experts say, when you're leaving the house to go shopping, think about what you need to purchase, make it a very short visit, make sure you're wearing your mask, make sure you're QR coding, social distancing, hand sanitising, all those things. But the key issue is as little human-to-human contact as possible. But please also know that police are, in a great way, in a large way, patrolling and making sure compliance is there. But again, it's as little as human-to-human contact as possible that's required.
Can I ask about South West?
Question: how many cases and how many deaths are you how many cases or how many deaths are you prepared to accept if we ease restrictions on the 29th of August with 50% vaccination rates when there are still cases in the community?
Please know that our complete motivation in New South Wales is to have our population as safe as possible. I'm not willing to accept any unnecessary people dying, any unnecessary death. That is not our aim. Our aim is to keep people as safe as possible and living as freely as possible. And especially given where the vaccination rates are. Now, obviously, once vaccination rates hit 70% and 80%, that is a different proposition. But given where our vaccination rates are, our intent as a government is always to keep our population first and foremost safe. That includes mental health as well as physical health. And also as free as possible. But please know that until you have vaccination rates hit 70% and 80%, you can't consider those high rates of hospitalisation. And that's why we're very keen to not only make sure our case numbers are reduced, but also that we have the higher rates of vaccination. But our strategy always remains to protect human life, to reduce hospitalisation, and that's why the vaccine strategy is key to that. It's not only to keep people out of hospital, but it's also to slow the spread down and have people infect less of their loved ones.
Deputy Commissioner, South West Sydney has the worst vaccination rates in New South Wales, 33% of people aged over 15. It's obviously the epicentre of this outbreak. Have we failed them? What can we do to get their vaccination
well,
rates?
That's why we're having a lot of community outreach programs. And please know the age profile of that population is much younger than the state average as well. So until recently, the health advice precluded a large number of people coming forward and getting vaccinated. Now that that health advice has changed, given the outbreak, we do have concerted efforts, whether it's mobile clinics, we're going out to community hubs to provide the vaccination, really ramping up the pharmacy access. The GP network is really primed as well. The New South Wales health hubs, we've established a number of mass vaccination centres, as you know, whether it's in Macquarie Fields, Prairie Wood and walk-in centres and other places. And then obviously from the 9th of August, we also have Kudos Bank Arena that will be available for that. So please know that we're increasing all the access points, but also working with communities to explain the benefits of the vaccine, not just in relation to keeping people out of hospital, but also in relation to reducing the case numbers and reducing the threat. and we do have a very concentrated initiative or campaign in those 8 local government areas in particular. Especially with critical workers, and we want to thank the businesses who have already signed up to encouraging, enforcing is perhaps a strong word, but we're encouraging business and community leaders to join with us in encouraging critical workers in particular to get vaccinated. As Dr. Chant and Dr. McAnulty have said, it's people aged between 20 and 40 who are very mobile in those communities that have the links between the older generation and the younger generation that are acquiring the vaccine, unfortunately getting the disease and spreading it. So we do have targeted programs across all age groups. But remember, there are still a lot of people in those older demographics that haven't had any vaccine. And as the health experts say, make sure people of all age groups come forward and get vaccinated. We know that the threat to human life and hospitalisation increases with age, as we've seen with Delta. Every age group is impacted. However, the one positive is 2 doses of the vaccine is keeping people out of hospital, is keeping people out of intensive care, and that's a really positive thing we can take out from the last few weeks, that the vaccinations, both vaccines work extremely effectively, and there is enormous incentive for people to come forward and get vaccinated, especially given where things are at, and especially given none of us want a day in lockdown longer than we need to. And that's certainly our aim.
Deputy Commissioner, can I ask you a question, please? Would that be okay? Deputy Commissioner, if I could ask you a question. Thank you. On your door-knocking rounds, particularly in West and South West Sydney, do you know the percentage of people that have been found not isolating at home when they should be?
No, I don't know that percentage here and now. We can certainly find that information out for you. What I do know is that Commissioner Fuller has committed to this strategy. It's a very important part of assisting New South Wales Health with the pandemic. Over 1,000 shifts, additional shifts this week across Greater Sydney with the assistance of ADF. I really think it sends a very clear message that if people want to go outside the public health orders, if they don't want to stay home when there's an order that says they should or they're directed to stay at home, at some point police will come to your premises, they will seek to make sure that you're at home, and if you're not, we will take action.
On the ADF, what special powers have they been given, and are you anticipating any sort of animosity in the community to soldiers being on the ground?
We haven't seen any animosity at all. In fact, to the contrary, many people right across Greater Sydney, not just in South West Sydney, have seen what the ADF can supply in terms of this operation. Yesterday, they worked with Meals on Wheels. They worked with some of our non-government organisations delivering care packages. As time goes on, there will be more and more of that. But I think what people need to understand is that ADF have been with New South Wales Police and government for some time now, right back at the start of the hotel quarantine operation, then down on the border for many, many days. They've assisted us right throughout in terms of quarantining in the contact tracing space, and of course now with the additional troops to help New South Wales Police with some of these checks, it's welcomed, and the vast majority of people are quite happy to make sure that the ADF are used and are welcome in any part right across the state.
Deputy Commissioner, part of what you do is welfare checks of people as well. When you've gone to a premises, has there been circumstances where you've actually gone to a home and they are in need of urgent medical care and you've had to get paramedics on site and things like that? No, I haven't heard of that at all. To the contrary, I think people are just welcome for the contact. And then, of course, ADF and police are able to redirect them to whatever support services they need. And, of course, we have the emergency management structure at local and regional level that are tied into local government and many non-government organisations and our welfare support and Multicultural New South Wales. There's a very complex but very simple arrangement there that at every level provides support to people in what is a difficult time.
A lot of people were stressed about what came out of the press conference yesterday about schools. Now, there's a roadmap happening, you're setting targets for vaccinations. Where does return to school fit into this plan?
Well, obviously, our key objective is to ensure that every HSC student has the opportunity and will have the opportunity to be awarded their HSC. And so that's our priority. And we obviously, health and education are continuing to discuss the safe way to make that possible. So our priority is definitely Year 12. As you know, we're starting to vaccinate all of Year 12 in those eight local government areas from the 9th of August. But it takes a couple of weeks for the vaccine, obviously, to be effective. So our aim is to prioritise Year 12 students to ensure that they all attain their HSC, and they all will. Can I make that very clear? Health and education are working very closely. In fact, we're getting some updates this afternoon on what life for Year 12 will look like. That's our absolute priority. But again, in terms of schools going back, that depends on the case numbers and the rates of vaccination, but also what the virus is doing. I know this is little consolation for those 8 local government areas, but in the main, we have managed to keep the virus out of the region, so all the kids there have face-to-face. The virus has been kept out of the Central Coast and other places, as well as parts of Greater Sydney. So we're looking at all those options in a safe way, and it will be based on the health advice at the time. Please know that, you know, the 2 priorities remain for us: getting kids back to face-to-face learning, but also to allow parents, obviously, or adults to get back to the workplace. So they remain our priorities, and again, they depend on those 2 things: case numbers and the rate of vaccination.
What part of the month do you think that you'll give certainty? Because I think for people homeschooling, it's very different if you think that homeschooling is just a stopgap. But if it's going to be for the rest of the term or perhaps some of next term, you're going to approach homeschooling very differently as a parent.
Oh, look, I think the decision we took to announce a 1-month lockdown hopefully demonstrates our keenness to provide as much certainty as possible. So we were able to say to parents, unfortunately, and I know out of all the things people have to deal with, that homeschooling's potentially the most challenging, especially if parents are undertaking their own employment, or for teachers who have to homeschool their own kids as well as teach classes. So homeschooling, we know, is a big pressure point, and any relief we can provide there, we will. And that's why we will need to provide as much certainty as possible. And the fact that we said there'd be at least another month of homeschooling for all children but Year 12 at least gives that ability to plan ahead. And we're very conscious that parents in particular need to be able to plan ahead. And so whenever we have any definitive health advice around that, we will provide that.
An upper house call for papers due this Friday.
I'm sorry, I didn't get the...
There is an upper house call for papers due this Friday. Will you comply with that call for papers, which is to hand over the health advice that you received about when New South Wales should, or when Greater Sydney should go into lockdown?
Oh, I have no issue with all of that information being made available, but what we say to the public is exactly what we know and exactly the advice that we have.
Some private schools are looking. There's been talk that some private schools are looking at rapid antigen testing through private companies. Where are we up to on being able to implement any of that sort of testing in schools, either for Year 12 or more broadly?
I'll ask Dr. Chant to help answer that question, but I know the New South Wales Health Department has been in touch with suppliers in relation to getting those tests readily available, and the extent of that will be based on the health advice, but I will ask Dr. Chant to help us.
So I can confirm that we are working closely with industry and also with the school sector to look at how to use whatever testing methods will be most appropriate and commensurate with the risk in those various areas. So we see a very significant use case for the rapid antigen tests, particularly in industry, and we're just working through the issues in schools in terms of what would be the appropriate risk mitigations we put in place.
We want people to be taking AstraZeneca, but something that's holding them back is the efficacy. Atagi is saying that with the shortened time frame, 2 shots of AstraZeneca will get you 55% protected, but with Pfizer it's 95% protected. That's a pretty tough sell, and some people are choosing to wait. Can you convince people that 55% is good enough? And is there the possibility of a 3rd booster shot that could lift that efficacy?
We know that we're going to have access to a large number of vaccines in the future. And so it is going to be the fact that we're going to be vaccinated multiple times against the COVID virus. At the moment, we're trading off long-term protection versus that short-term protection. And both of the vaccines, after 1 dose, reduce your risk of hospitalisation, and after 2 doses are pretty equivalent. Obviously, in that 4-week interval, we're just trading off that longer-term protection rather than the effectiveness in the short term.
Longer term, do we go through a process, say we get to 80% in November, do we then every year, because people haven't had their booster shots then risk having more restrictions come back in because booster levels aren't high enough?
No, so what will happen is it will be a bit like flu eventually. And we know we have bad flu seasons, and we have many impact, and it's cyclical in terms of some of the flu impacts. But in the end, we'll equilibrate with COVID. It will throw us a few curveballs, and so we'll have to have new updated vaccines. It will be a challenging transitional space where we will have to keep getting vaccinated, and the vaccines are vaccine manufacture has actually really improved quite a lot in terms of the fact that we've now got the mRNA vaccines like the Moderna and the Pfizer. And I understand they can actually be changed quite quickly, a little bit along the lines of the flu vaccine that changes every year. So that gives us hope that we can keep ahead of the virus.
Do we know how soon we can get that third booster shot? There's some suggestion it could be 6 months. So everyone who had AstraZeneca in Greater Sydney will be operating at 55% protected, 40% less than everyone with Pfizer?
My understanding is I'll have to check those data points because I'm not quite sure that they're correct. My understanding is the 4-week interval traded off longer-term protection where you need a booster. So in terms of the key messages, I understand that there will be larger volumes of vaccines, and ATAGI will consider and provide the advice. And as we always do, we follow the ATAGI recommendations, but they're going to be looking at mixed schedules, boosters, vaccines against the newer strains, and that will be incorporated in our advice.
This aged care rule that is supposed to have staff work at only one facility when an outbreak is declared. Turns out that doesn't apply to agency staff because their whole reason for being is to be a surge workforce. So agency staff can work across multiple facilities, according to what Greg Hunt said yesterday. Do you think that should change?
Look, I think the principles we want is we want to have least mobility of workers across multiple facilities. So I would urge that people that are using agencies try and ask for the same agency staff. I think it would be really appropriate that I know the Commonwealth is continuing to roll out vaccination for aged care workers and for aged care facilities. And so I would also urge, if you've got regular agency staff in your facility, making sure they've got access to the vaccination immediately.
Aged care workers getting vaccinated, sorry. We're hearing reports of aged care workers in the bush, in Newcastle and Orange, having their vaccine appointment cancelled because the Pfizer is being redirected to HSC students in the city. How concerned are you that that is happening because those staff could end up losing their jobs because of the mandated vaccine?
We will obviously consider all of those impacts and work with the Commonwealth, who is also supplying Pfizer vaccine to general practice in a number of those areas to look at access points. Clearly aged care are a priority, and the Commonwealth's got separate access points for aged care. So if there's any particular examples of that, we would be happy to follow up in relation to that. Certainly the greatest risk exists in southwestern Sydney and western Sydney. We have to put vaccination as part of our tool in protecting the community. As I said, it both has an individual benefit in protecting against hospitalisation and death, but also some transmission benefit in protecting you, your loved ones, from transmission risk.
Just in terms of Year 12.
Is there staff shortages as a result of people being close contacts?
Whenever we have a case, we identify close contacts, and then there's an operational response. So my understanding is the ICU is operational, but obviously there takes a time for us to get new and additional staff to roster in. It's a usual process we have when we have close contacts identified.
Just in terms of Year 12, is there a strategy being developed? Obviously, Year 12 students in southwest and western Sydney are going to be vaccinated, but there are thousands elsewhere that are going to go back to school in a week and a half. And I think there's a lot of angst that perhaps that these students are sitting ducks for the virus because a lot of them can't get vaccinated because they're under 18. Is there any consideration being given to focus vaccination on that age group?
So the area that, if we had to focus vaccine, we'd be focusing vaccine on that 18 to 39-year-olds, which probably picks up some of those HSC students because they're transitional. They're often got part-time jobs in supermarkets or fast food, food premises. So yes, they would be a priority, but at the moment we have constraints in the vaccines we've got available to offer them. And at the moment we have to make choices, and that's difficult. But the main message is we do want workers, particularly those authorised workers in the southwestern Sydney and Western Sydney, to come forward and get vaccinated. We're seeing too many outbreaks in workplaces, which then set off chains of transmission into the households of those work colleagues.
Just on that age group, because it's a crucial age group, and it's also a lot of those people would be holding out for Pfizer. So when are we getting our big Pfizer drops?
Look, that's a matter for the Commonwealth, and they give us forecast up to a certain point in time. But I think in general sense, Pfizer will become available in more at quantities later in the year. So that's really a question for the Commonwealth to confirm. I think there is a report on the Commonwealth website which looks at the availability of vaccines over the forward schedule.
Just quickly whilst you're there, Dr. Chant, on exposure sites, there were 200 cases yesterday with a whole bunch in the community, but only 3 new exposure sites. Is that because Health is still interviewing those cases? And are all the exposure sites alerted to the public, because some vaccination centres that are exposure sites aren't, as I understand?
So vaccination centres, you can imagine that we actually know exactly who was there. It's pretty easy to know who's the staff on roster and also who is the people that have attended. So where we're confident we can actually reach everyone, we don't put it on as an exposure site. And that goes for other small workplaces. So if there was potentially a small workplace where we know exactly who was there, there is no risk to the public. So we don't put that on the website. What we do is we put on the website any of those that are outward facing.
On construction, you've lifted the construction ban, but of course there are still about 70,000 workers that live in those 8 LGAs who are unable to work. So the industry effectively is still ground to a halt in some cases. Projects just can't operate. What are you doing to address this? Are there going to be any changes or other rules for those workers to be able to come out? And are there any other financial supports in place for the industry?
Yeah, well, as you know, there are financial supports there for all businesses and all individuals who have had a reduction in hours or a reduction in turnover. In relation to sections of workers in those communities, those 8 local government areas, we're as keen to see them get back to work as anybody else. Can I encourage them to get vaccinated? Can I please say that government has many more options when we have and see high rates of vaccination in those communities? Because as Dr. Chant and the health experts tell us, not only does it keep people out of hospital, but it reduces the spread and has a positive impact on reducing case numbers. So can I please stress, based on the health advice that we've received, that all critical workers, all workers wanting to get back to their workplaces should come forward and get vaccinated. That gives us more options in terms of supporting industry. And I do want to commend industry and business leaders in those areas. We've had a number of conversations with them through New South Wales Health or through government directly. Industry has been very positive in standing up and trying to encourage their workers to get vaccinated. And Health is looking also at opportunities to work with industry even more closely moving forward on ensuring that workers get the vaccines.
So, Premier, just to spell it out, for those 8 LGAs, would you be willing to say for those 8 LGAs, if you're vaccinated, you can work outside that area?
Well, I certainly will be saying that the health advice will be looking at the number of cases and also the vaccination rates in cohorts of workers and in categories of people who we want to provide more freedom to. I can't stress enough that our ability to live more freely on the 29th of August is dependent upon vaccination rates as a tool, but also seeing those case numbers go down. We know vaccination will have an impact on case numbers going down if the people in those 8 local government areas in particular come forward and get vaccinated. And we know we're putting a lot of pressure and attention on you, but please know this is to prevent hospitalisation and to get us out of lockdown. And all of us want to see that. And I know people in those 8 local government areas in particular have had a lot of pressure placed on them. I want to thank them for their sacrifice, but also know that we're working with you, working with your community leaders, with your business leaders, with families to make sure we provide that support to encourage those rates of vaccination, but also make sure people have all the incentives they need not to leave their homes. in the way of support, because it's really important for all those things to be happening.
On the issue of outdoor dining, on the issue of outdoor dining, is that something that you consider to be a low-risk measure that could come back if we do indeed meet targets?
Look, I want to stress that our priorities are getting children back at school, getting students back at school, and getting parents back to work. They're our two priorities. And again, all those other things which all of us would love to do, whether it's getting basic services that we can't have access to now or anything else, will depend on how the case numbers are going and what vaccination rates are. But please know that we're looking at those opportunities, but we won't be able to announce anything until closer to the 28th of August, because the case numbers is anyone's guess, and we don't know yet, and I have to be honest about this, we don't know yet whether we're through the worst of it or not. There's clearly been a plateauing the last week, but we don't know if we're going to see them worsen before they get better, and that unknown causes us to make sure we adopt the position we have moving forward about strict lockdown, but also high rates of vaccine. Great, thanks everybody.